Sometimes adolescents, especially say girls, the period's a little delayed, they get stomach aches for a long period of time, and he does a blood test, and he finds a thing called the SED rate's high, and he sends it to you because he thinks that the kid could have a possibility of a disease called Crohn's disease.
Crohn's disease is a serious illness. This is another category of what we call inflammatory bowel disease. And ulcerative colitis, what we just discussed, is one of this category. The other categories are called Crohn's disease. The difference is that Crohn's disease may involve any area of gastrointestinal tract. When colitis involves only colon, Crohn's disease may involve any segment of the gastrointestinal tract.
They also get something like fistulas or something with it?
Yes, Crohn's disease is what we call transmural disease, when inflammation of the intestine, small intestine or large intestine, may unfortunately cause complication when fistula or opening of the intestine may occur.
If you do see a kid, what is your general approach to the problem?
Well, the treatment should be provided early and quite aggressively because of the fear of these complications. The approach to therapy of Crohn's disease is similar to therapy of ulcerative colitis. However, some modifications are made.
Which are?
The Crohn's disease is a condition which may involve small bowel only with sparing of colon. In other words, colon is not involved. In this case, biologic therapy, which I mentioned in regards to ulcerative colitis, is frequently become the first therapy of choice.
What is the prognosis with something like Crohn's disease?
The prognosis, someone with Crohn's disease, the prognosis, again, in at least half or 50% of patients is quite good, and therapy is quite efficient. In somewhere around 30% of patients, the treatment becomes extremely difficult.
The long-term prognosis and the complicated case?
The quite significant proportion of children with Crohn's disease who don't have good response to therapy eventually have surgery when they become of adult age, and sometimes even when they are adolescents.
So the general rule is Crohn's is a little more difficult to handle generally?
Crohn's disease is kind of less straightforward condition because it involves any area of gastrointestinal tract. An approach to Crohn's disease which involves the small bowel or very proximal small intestine, sometimes extremely difficult.
Are there any newer drugs coming down the grapevine soon?
Well, at this point, combination of immunosuppressive drugs and biologic treatment is becoming more and more conventional for therapy of small bowel Crohn.
And what is the usual age that you see Crohn's disease?
The majority of children who develop Crohn's disease are over the age of 10. However, there's a significant percent of children who develop Crohn under 10.
Is it more boys, more girls? What's your opinion?
It is very, very similar proportion of boys and girls in Crohn's disease.
It's a non-sexist disease, huh?
Not really. There's some predominance of boys or girls in any of this category, but I would say about 50-50.
Is there ever a time it's difficult to diagnose between the two types of colitis?
Sometimes it is, because Crohn's disease may involve any area of the gastrointestinal tract, and sometimes it's involved colon only, and then differentiation between Crohn colitis or ulcerative colitis may become very difficult.
So a biopsy of the area involved will differentiate easily?
Well, the differential diagnosis is made usually based on colonoscopy. Again, the picture on colon, or when the colonoscope or endoscope is placed inside the colon, is usually allow us to differentiate Crohn colitis versus ulcerative colitis.
But in pediatrics, we have several problems. A lot of drugs come out that are fluid tested on pediatrics. That's true.
Well, most of drugs are less tested in pediatrics simply because it's difficult to design a good study when the children may be involved. Most of parents would not allow the children to take drugs for the study or for the testing. Most of the adults would just do that for whatever reason. Infants, especially very young children, are very difficult to test.
What is the youngest age you ever seen a kid with Crohn's disease?
Well, the youngest child with Crohn's disease I've seen is somewhere around 2 years. The youngest child with Crohn's disease described in the world literature, I believe, is just under 1 year of age.
Well, thank you very much.
My pleasure.